Welcome back, everybody, to another deep dive. Today, we're going to the heart of Baltimore, focusing on Madison East End, and using this really incredible 2017 neighborhood health profile from the Baltimore City Health Department. Think of this report as a snapshot of the community's health, not just a bunch of numbers. And our goal today is to kind of help you understand what this data means for the people who live there.
And you said it. This report, it's really designed to spark conversation
Mm.
and inspire action, not just to sit on a shelf. So we want to figure out, what factors are influencing health in Madison East End
Yeah.
and what can be done to improve things.
Okay, so let's unpack this. One of the first things that really stood out to me was how young this neighborhood is. Almost 30% of the residents are under 18, compared to about 21% citywide. That's a lot of young people.
Yeah, and a lot of those young people are being raised in single-parent households. The report shows 76.8% of households are single-parent, which is significantly higher than the citywide average of 64.8%. So that means a lot of families, may be dealing with unique challenges. Think about like childcare access, financial strain, even just the stress of managing everything solo. All of these things can kind of have a ripple effect on health.
Yeah, that's a really important point. It's not just about the numbers themselves. It's about really understanding those stories behind them.
Absolutely. And when we look at the economic picture in Madison East End, it gets even more complicated. The median household income is only around $27,454, which is much lower than the city average of $41,819.
Wow, that's a huge difference. And to make matters worse, unemployment is a staggering 26.4%. Over 1 in 4 people are out of work. No wonder the report highlights a family poverty rate of 45.2%.
Yeah, the city average is 28.8%. So you can see how this economic hardship is really hitting this neighborhood hard.
And the report uses this thing called a hardship index to capture all of these economic factors. It's basically a measure of socioeconomic disadvantage. And Madison East End scores a 90 out of 100, the highest in all of Baltimore.
Yeah, that score, it really brings home the reality of the struggles that many residents face. And it helps us understand why health outcomes might be different here compared to other parts of the city.
Yeah, it feels like we're already getting a much clearer picture of these challenges.
Absolutely. But it's not just about income and jobs. The physical environment, or like the built environment, as the report calls it, also plays a huge role in shaping health. So let's take a look at that section.
Okay. One thing that really jumps out is the density of tobacco stores. In Madison East End, there are 46.3 tobacco stores for every 10,000 residents, which is more than double the city average of 20.9. So that's a lot of exposure to temptation, especially for young people.
And that temptation, it's kind of coupled with a lack of healthy alternatives. Green space in the neighborhood is extremely limited, only 13.7% compared to the city average of 33.1%.
So that means fewer parks and playgrounds, community gardens, places where people can connect, get active, enjoy nature. It's almost like the environment itself is working against residents' efforts to live healthier lives.
Yeah, it's like one obstacle course after another. And then when you factor in the visual impact of over 1,794 vacant buildings per 10,000 housing units, which is way higher than the city average of 562.4. It's easy to see how this can affect the overall feeling of a neighborhood.
Yeah, it's like this constant reminder of disinvestment and neglect, which can impact residents' mental and emotional well-being, too.
Absolutely. And those vacant lots and buildings, they can become havens for rodents. The report highlights a really high rate of rat service requests to 311 in Madison East End, over 915 requests per 10,000 households, which is more than double the city average.
Wow, so on top of everything else, residents are dealing with environmental hazards that impact their health and quality of life. It's really eye-opening to see how all of these factors intertwine.
It's like a chain reaction, isn't it? One challenge leading to another. Now, this leads us to another crucial area, education and safety.
Right, because how can kids focus on learning when they're facing so many obstacles outside of school?
Yeah, the report. It reveals some pretty concerning educational indicators. Kindergarten readiness is lower than the city average, and reading proficiency lags behind in both 3rd and 8th grade.
But what really caught my attention was the high school absenteeism rate. It's a staggering 53.2%, meaning over half the high school students are missing 20 or more school days a year. That's more than 14 percentage points higher than the citywide average.
Wow, that really suggests there's some deeper issues at play, right? Maybe it's lack of resources, safety concerns on the way to school, or even just the disconnect between what's being taught and the realities these students face outside the classroom.
And speaking of safety, the statistics are pretty alarming. The non-fatal shooting rate is 20.6 per 10,000 residents. That's 3 times the city's average. And the homicide rate is also double the city average.
It really paints a picture of a community that's grappling with some serious safety concerns. And what's even more telling is that high rate of animal abuse service requests to 311, this suggests there might be kind of a broader issue with violence in the community. And, research shows a pretty strong correlation between animal abuse and violence against people.
Yeah, it's heartbreaking to think about. And it definitely raises some red flags. So let's shift gears a bit and talk about housing and food access, which are also really crucial for health. The report reveals a very high average annual lead paint violation rate in Madison East End, 81.6 violations per 10,000 households. That's over 8 times higher than the city's average of 9.8.
Wow, this is a major concern because lead paint exposure can have, really serious consequences,
Yeah.
especially for young children. It can lead to developmental delays, learning difficulties, and other health problems. So it's a long-lasting issue that needs immediate attention.
Absolutely. And then there's the issue of food access. The report says that 40% of the land in Madison East End is classified as a food desert.
Yeah, a food desert basically means that residents have limited access to fresh, healthy food options like fruits and vegetables, lean protein. And it's a significant problem because
Yeah.
if you can't easily get healthy food, it's much harder to make healthy choices.
Right. That makes perfect sense. And the report actually contrasts this with the city average, where only 12.5% of land is considered a food desert. So you can see the
Yeah,
stark difference.
the double whammy, right?
Right.
Not only is there a lack of fresh food options, but the report also highlights a high density of carryout restaurants and corner stores, 27 carryout places, and 36 corner stores for every 10,000 residents.
So even if residents are trying to make healthy choices, they're often limited to what's available at these corner stores, which might not be the most nutritious.
Exactly. And while it might seem like good news that there are no fast food restaurants in Madison East End, it doesn't necessarily translate to healthier eating habits.
Right. They're kind of stuck between a rock and a hard place.
Precisely. And this limited access to healthy food likely contributes to the concerning health outcomes we see in the report. For example, life expectancy in Madison East End is just 68.9 years, significantly lower than the city average of 73.6 years.
It's heartbreaking to see such a disparity, and when we look at the leading causes of death, it really paints a bleak picture.
Yeah, the report shows higher rates of death from cancer, lung cancer, heart disease, stroke, and even septicemia, which is a serious bloodstream infection in Madison East End compared to the rest of the city.
And infant mortality is another area of concern. The rate in Madison East End is 12.1 deaths per 1,000 live births, higher than the citywide average of 10.4.
And the report also highlights higher rates of teen births, preterm births, and low birth weight babies in this neighborhood, all of which are kind of interconnected
Yeah.
with those broader health and social challenges we've been talking about.
It's a complex web, and it's really sad to see how these factors are impacting the most vulnerable members of the community.
And it doesn't stop there. The report reveals that 4% of children in Madison East End have elevated blood lead levels, compared to just 1.1% citywide. This goes back to that issue of lead paint and the urgent need for solutions to protect these kids.
It's a lot to take in, but it's essential information. Now, I'm curious to see how all this data translates to overall health rankings. How does Madison East End compare to other Baltimore neighborhoods?
Well, unfortunately, the news isn't good. The report shows that Madison East End consistently ranks in the bottom third for most health outcomes.
So it's not just one or two isolated issues, it's a pattern of disadvantage across multiple areas?
Exactly. And when we think back to that hardship index score of 90, it becomes clear that socioeconomic factors are really playing a major role in these health disparities. It's like a domino effect, with poverty and lack of resources, leading to this cascade of negative health outcomes.
But even in the face of all these challenges, I'm kind of curious about the community's strengths. What are the bright spots that we can focus on?
That's a great question. The report itself doesn't dive too deeply into community assets. But I think that's where the real opportunity lies. Every neighborhood has these hidden strengths. Resilient residents, dedicated organizations, maybe a strong sense of community spirit.
Exactly. It's about identifying those assets and finding ways to leverage them to address the challenges. For example, maybe there are community gardens popping up, or residents are organizing neighborhood cleanups.
Yeah, those are great examples. And it's about building on those existing efforts, connecting residents with resources, and working collaboratively to create lasting change.
It's about shifting the narrative from one of despair to one of hope and possibility.
Absolutely. And I think a crucial first step is understanding the neighborhood's demographics, The report provides some fascinating insights into the age, the racial and ethnic makeup of Madison East End.
Okay, let's delve into those demographics. What does the report tell us?
Well, one thing that immediately stands out is that Madison East End ranks third out of 55 Baltimore neighborhoods for the percentage of residents under 18.
So this really confirms that youthful energy we talked about earlier.
Precisely. And on the flip side, it ranks 50th for the percentage of residents aged 65 or older. This means the neighborhood has a much smaller elderly population compared to other areas of the city.
It sounds like we're talking about a community with a very distinct age profile, with a larger proportion of young people and fewer seniors.
Exactly. And when we look at racial demographics, the report shows that Madison East End ranks 17th for the percentage of Black or African American residents, suggesting a higher concentration compared to the city as a whole.
And it also ranks ninth for the percentage of residents who identify as Hispanic or Latino. So it seems like we're talking about a pretty diverse community.
Indeed. And these demographic insights are really important because they help us understand the unique needs and experiences of the residents.
So it's not just about looking at the overall numbers. It's about understanding the people behind those numbers.
Exactly. And these demographic nuances, they should inform any efforts to address the challenges and improve health outcomes in Madison East End.
Yeah, it feels like we're really starting to see this holistic picture of Madison East End. You know, the challenges, the demographics, and hopefully those potential solutions. But before we wrap up, I'd love to hear your final thoughts. What's that one thing you hope our listener takes away from this deep dive?
I think the biggest takeaway is that health is so much more than just going to the doctor or having access to health care. It's about the environment we live in, the opportunities we have, the resources available to us, and so much more. What we see in Madison East End, it's a stark example of how these social and economic factors can have a profound impact on health outcomes.
Right. It's almost like this web, isn't it? All these factors are interconnected. Yeah. And they're influencing each other. And sometimes it feels like the odds are stacked against certain communities.
Absolutely. But the good news is, we're not powerless. This report is a call to action. And it starts with awareness. Now that our listener kind of understands these challenges facing Madison East End, they can start thinking about ways to get involved, to advocate for change, or even just to have, more informed conversations about health equity.
Yeah, that's a great point. It's easy to feel overwhelmed by all this data, but knowledge is power. And even small actions can make a difference. Maybe it's volunteering at a local community garden, supporting a neighborhood organization, or simply talking to friends and family about these issues.
Yeah, every bit counts. And I really believe that change is possible when we work together to address, those root causes of health disparities.
I couldn't agree more. So to our listener, we hope this deep dive has given you a new perspective on the complexities of health and the importance of community. Remember, you have the power to make a difference, and we encourage you to use your voice to advocate for a healthier and more equitable future for all Baltimore residents.
Yeah, and remember, every community has its own unique strengths and challenges. So the next time you hear about a neighborhood facing health disparities, take a moment to learn more about their story. You might be surprised by the resilience and that potential for positive change that you discover.